welcome you all to the third session of our Ovarian Cancer Wellness Symposium, Reflections of Beauty, Ovarian Cancer Treatment and Self-Image. So thank you so much for joining us tonight. We greatly appreciate it. This program is made possible by individuals and partners dedicated to providing learning opportunities and a platform for our teal community to be inspired. We would like to thank our local community partner who has been presenting and working behind the scenes diligently to make sure that this program goes off smoothly, and that would be Northwell Health. And then we would also like to thank our national partners, GSK, Merck, Eisai, and Novocure for their support. Tonight, we are going to dive deep because I all want you to look at yourselves in the mirror and see your self-worth. It is so incredibly important as you navigate your journeys. So we have some very special guests that are going to be joining us. So when I announce your name, if you could please just say hi, I would greatly appreciate it. So we are going to begin. We have tonight with us Valerie Burger, a registered nurse for 36 years. And Valerie Burger is the AVP of Cancer Services from Northwell Health, and she is kindly going to be moderating your discussion tonight. So please, everybody, give a warm welcome to Val.
Hi, everybody.
And next, I would like to welcome Jennifer Hernandez. Jennifer Hernandez is an oncology physician's assistant at the R.J. Zuckerberg Cancer Center for Northwell Health. So Jennifer, welcome, and thank you for joining us tonight and being part of our panel and sharing your expertise with our audience.
Hi, everybody. Thank you for having me tonight.
Thank you, Jennifer. And our next guest, and we are very delighted to have Yota Batsaris from Look Good, Feel Better. She is a national trainer and a licensed cosmetologist, and I think you all will fall in love with her energy and enthusiasm. So we want to thank you all, and I'm now going to turn this over. Yota, can you just say hi to the audience first?
Absolutely. Hi, everyone.
Thank you so much. And now I am going to kindly turn this program over to Valerie Burger, who is going to moderate tonight. So Valerie, please take it over.
Thank you so very much. I'm so honored to be here. And I love the name of this event, Reflections of Beauty, because when I look out and I see all of you there, every single one of you is a reflection of beauty, including myself, which is sometimes hard for us to see and know, right? But all of what we do, all of what we go through is beautiful. And so hopefully tonight you'll get some takeaways and be able to really help see and help augment that beauty inside to shine and come through. And we have some fabulous people here to help us. So first, I'd like to ask Yota, can you please share with us a little bit of information about the programs and services that are offered through Look Good, Feel Better, and those services that you have that help patients regain their self-confidence as they navigate potential appearance-related side effects because of treatment?
Exactly that. Thank you, Valerie. So with Look Good, Feel Better, we do help with those side effects that you may be experiencing or may not be experiencing during your treatment, but they are aesthetic related. So Look Good, Feel Better is a non-medical brand neutral program dedicated to improving your quality of life. So we want you looking in the mirror and feeling great as you may go through some changes during your treatment. We offer complimentary workshops that teach beauty techniques, helping addressing visible side effects, for example, dry skin, patchy skin. So little things like that that we will navigate through and teach you how to, conceal or conceal pretty much. Give the illusion that, that's not happening. We try to help you find some normalcy during this time when things, could just be changing. Look Good, Feel Better's workshops are completely free of charge. We include lessons on skincare, nail care, cosmetics, wigs, and turbans as well. And we also offer our workshops virtually. So everything we talk about, you can actually find online at lookgoodfeelbetter.org under videos. So if there's something that would really interest you, feel free to join us on YouTube and check us out too there.
I've heard so many wonderful things about this program. It's been around for a long time, and you guys have been servicing our cancer, people with cancer for quite some time. So, yes. I love, going for a pedicure, not so much a manicure because they never last. right? But so having a manicure, pedicure, it can be very relaxing, having somebody, kind of rub you and make you look pretty and glamorous, so maybe Jenny or Jutta, can you tell us, is it safe for people who are in active treatment to go to a professional salon?
Thank you, Val. That's a great question because, yes, I agree that is one of the most relaxing things that we can do, and it does make us feel better, inside and out. And it's something that a lot of us look forward to do. It's really something that everybody should speak to their provider about. There are certainly times during the treatment when it would be absolutely fine, to go ahead and do that. Sometimes if patients are on active chemotherapy and their immunity is low, it may not be the best time to do that, or there may be modifications that the providers give, in terms of what exactly the nail provider can do, in terms of maybe not cutting the cuticles, not doing callus removal, things like that. So definitely speak to your provider and find the best timing, for that service during treatment. But it absolutely is something that can be done while undergoing treatment. It just has to be done at the right time.
Is there anything we can recommend to alleviate brittle or soft nails?
Absolutely, I can take that. So at Look and Feel Better, we are non-medical. So in agreement with Jennifer, you would definitely refer to your physician. With nail care tips and in our nail care workshop, what we teach is different things to keep those cuticles hydrated, especially since, during the time of sanitation, hand washing, and naturally drying skin during treatment time, on how to keep those cuticles really hydrated, maybe not necessarily clipping them, but pushing them gently back if they are in the way, using mild soaps instead of really harsh chemicals or harsh soaps when you are washing the dishes, or just, like I say, let them pile up, let somebody else do them. We also talk about, wearing gloves, some changes that you may be experiencing, maybe some discoloration, or maybe that are super brittle. There are very many polishes out there that are considered safe and that you could use. And anything with regards to manicures, and again, like Jennifer said, there are times when you just want to ask for your physician's okay to go ahead and do. But basically, to answer your question, Valerie, cuticle hydration, and then you can do a nice polish strengthener for brittle nails, colored polish if you find the discoloration happening. And if they do fall off, then that's okay. Just be patient because they will come back.
So I guess that's the nail care routine that you would recommend. Is there anything specific for skin care?
Absolutely. So Look and Feel Better also offers our skincare and makeup workshop. That's one of the workshops that I love hosting. And we definitely, again, partner with your physician. But during this time, fragrance-free products, gentle products, all those aggressive anti-aging products are not things that you want to be putting on your skin during this treatment time, because your skin can be totally different. I mean, we've had ladies in workshops, and Jen's agreeing. Jen, do you want to add something medically real quick to that? And we can kind of back and forth it.
Sure. Yeah, that's a great point. I mean, I think, we see that the skin does change, from the different treatments, and it's usually just temporary. But you just have to be careful with new products. So try to stick to things that, you may have used. And like you said, things that are very natural, without perfumes and things like that.
Especially anti-aging products. Those are products that we recommend you just kind of put on the shelf for a while until after treatment, because again, anything that resurfaces the skin or changing the skin, could add to sensitivity during your treatment time. So we just recommend mild, fragrance-free, save the aggressive stuff for after. And obviously skincare, sun care is very, very important, because I just had a lady in a workshop who would sunbathe and crochet outside, never had a problem. And then she started treatment, and no joke, she came into a workshop completely sunburnt for being outside for a few minutes. So you don't know how your skin will react to treatment and sun exposure. So we highly recommend the sunscreen during that time as well.
So maybe those sort of baby products that are out there, those things that are gentle for really tender baby skins, right?
Anything with an SPF 30 and over is great, is what we recommend in our workshops. And again, fragrance-free, most sun care is pretty mild. I mean, unless you're going to a cosmetic aisle that has bronzers and shimmers, which, most sun products are. There's mineral and chemical sunscreens, and we teach in the workshop when to use one over the other. That's all.
So Jenny, we're talking a little bit about, skin and what can happen to your skin. So like Jutta just pointed out, sometimes you can have really weird reactions. What happens if you have a skin rash? What should you do? Where should you go? Who should you talk to about it?
Well, absolutely. That's a great question. It's something that comes up quite often. It could, depend on the weather, the time of the year, where you are in terms of your treatment, what type of treatment you're on. If there's any type of rash, especially something that you've never had before and you're on active treatment, definitely notify your physician and your oncology team. Some things are, we expect and may come and go, but then there are other things that can be very severe and cause problems which may delay treatment and require, more serious, prescribed medications. We at our, it's different at each institution. We're very lucky at our institution to actually have dermatologists in our center that specifically see our patients that are on treatments. So it's really great. We get to work with them for maybe some of these rashes that are a little difficult to treat. So definitely ask your team about that if they have contact with a dermatologist. But there's a lot of different rashes that, may just need it could be even an over-the-counter treatment. So definitely speak to your team, especially when you're on treatment, about any kind of rash that you have.
Excellent. So we know that treatment can be very fatiguing, and sometimes you'd feel like, my daughter's word, duty butt, right? You really just don't feel like yourself. But sometimes if you put on makeup, you feel a little bit better. Like the name of the program, right? Look good, feel better, right? So do you have any advice on which sort of makeup you should use to enhance your appearance? And when you have treatment, and maybe when you're not feeling so confident, like what's your go-to?
Absolutely. So we are brand neutral, which means we won't say one product over another, but there's so many things out there, and you can definitely use what you're already using, as long as the ingredients don't, the scent, the fragrance doesn't make you upset, or there's something anti-aging or abrasive ingredients in it. Most cosmetics are pretty easy to use. So we recommend, in our makeup section, we talk about using a concealer to conceal different skin, pigmentation of the skin that may be changing. We talk about a foundation to cover. We talk about the skincare and the sunscreen. We talk about setting everything with your makeup. We address potential hair loss or thinning, especially in this area right here, as well as, the rest of your body. But when we find our skincare, what we find in our skincare makeup tutorial is that a lot of times you may find that your eyebrows are thinning, your lashes are thinning, or shedding completely. And I'm going to demo when you give me the go ahead, Valerie.
I'm almost there. I'm right there.
Yeah, I'm just gonna run through it. We demo in our workshop, which we will be demoing today too, on how to recreate a brow in the event that you lost it. So with makeup products, again, you can already use what you already have at home. And if there's anything, again, that's you question the ingredient or the fragrance or whatnot, you can go ahead and double check with your physician.
I know a lot of ladies don't feel fully dressed unless they have their lipstick on. My mother always used to tell me, you'll look a little better if you put some lipstick on. I'm never really a lipstick girl, but I do feel fancy when I wear it. So it works. So everybody is unique. Hair loss, we're going to talk even more about that in a little bit. But, unfortunately, hair loss is hair loss everywhere. So you bring up, Jutta, that you can lose your eyebrows. And when you don't have eyebrows, or you have very thin eyebrows, the whole contour of your face changes. So Jenny, maybe you could tell us, what's the average sort of time to losing eyebrows, and when do they maybe grow back? And then
Sure.
we can have Jutta show us just how glamorous you can be.
Absolutely. So yes, that is something, that we see quite often. Usually the eyebrows and the eyelashes are kind of the last things to fall. So patients often lose the hair on their scalp first, when they first initially start their treatments, in the first couple of weeks. And then, it can be sometimes a few months before the eyelashes and eyebrows start to fall out. So they're a little bit longer to fall out, but they are the first ones to start coming back in as well. We usually see that within the first 3 months after stopping at the conclusion of treatment, is that when the eyebrows and eyelashes start coming back in, as well as the hair.
So if you've lost your eyelashes, your eyebrows, what can you do? Can you show us what we can do?
Absolutely, thought you'd never ask. So I have my brows drawn in, as you can see, but what I'm going to show you, and this is what we talk about in our workshop, and also you can find on YouTube at lookgoodfeelbetter.org. I'm just going to cover this up with some surgical tape, this brow up, because what we're going to show you is how to connect 3 dots. I haven't connected dots since elementary school, and I started again with Look Good Feel Better. And this trick not only helps with anyone experiencing some loss or thinning, but especially with waxing issues like I had. So we're going to connect 3 dots and then use light feathery strokes to connect it and redraw your brow. If your brow is thinning, you may not need anything like a pencil. You can just take a cotton swab, dip it into a little bit of powder or eyeshadow, and then just lightly fill in any areas that are thinning. But in this case, I want to show you what to do if you've lost your brow completely. So again, connecting 3 dots. Now I have my magnifying mirror right here if you see me referring to it. The first dot that we're going to draw, we're going to take our tool or pencil, or if you don't have a pencil and you want to use a brush and eyeshadow, you can grab a brush, dip it into some eyeshadow. And the first dot we're going to draw is right here, lining up against the side of your nose. Line it to your tear duct, through your tear duct, and then stop right at that orbital bone. It naturally stops. So we're using the features of your face to recreate the brow that's created perfectly for you. So here we go.
But don't use a Sharpie, right? Don't use a Sharpie.
I mean, yeah, I can't. No, please don't, Valerie. Okay, here we go. So I'm going to go ahead and draw. This is visible. There's dot 1. Can you see it?
Yes.
Okay. Dot number 2, this is very important that you are looking straight into the mirror, because you're going to line up your pencil or your brush on the outside of the colored portion of your eye. Okay, that's really important because we're talking about not the pupil, but the iris, the colored portion of your eye. When you're looking straight into the mirror, like I am right now, I line up my pencil right on the outside of that colored part and make that second dot. Now, what would happen if I'm not looking straight into the mirror? That colored part moves, dot number 2 is relocated, and you're going to be, wandering the city looking like Spock. So dot number 2, looking straight into your mirror. Alrighty. And then dot number 3, side of the nose, the outer corner of your eye, and stop once again right at that bone. The bone just naturally stops it. And there's dot number 3. Then you would take your brow tool or pencil and you would lightly connect those dots, again, using those light feathery strokes that I was talking about. Say you don't have a pencil and you want to go ahead and use a cotton swab, which is we at Look and Feel Better love to talk about hygiene, and using disposable products just keeps everything cleaner, goes straight into the trash. When you're done, I can go ahead and connect those 1, 2, and 3 dots. Just like this. And there you go, you'll have a brow that actually kind of matches up with the second. Now, you may be thinking, well, how do I know if that's what my brow is supposed to be? Well, take a look. It lines up pretty well with my natural brow. And I did this all with a Q-tip and a little bit of powder in a matter of seconds. So I hope that's helpful. But that's how we would address hair loss. Isn't that great?
That's amazing. Yeah. That's so 1, 2, 3.
Yes.
And at that bone. And I guess you could give it a little bit more of an arch if you wanted to.
Absolutely. Now's your time. Now is your time to change the shape and have fun. Just keep within those 3 dots so that it lines up with the features of your face.
Awesome. Awesome. So in keeping with hair loss, we can talk about hair loss on your head, and are there ways to prevent that? So I know Jenny is going to talk to us a little bit about a process called cold capping. Jenny, can you tell us what's involved with that? Is it painful? Can patients do it themselves? What's it all about, Alfie?
Absolutely. This is a conversation that we have with our patients all the time, especially patients that are brand new to us, that are starting their treatment right after coming to us. So there's something called a scalp cooling system. And what that is you've heard different terms. There's cold cap, there's penguin cap. There's different systems out there. It depends on really which institution you're getting your treatment to see what type of system they may offer for this. Some places have machines that help with, as you see here, thanks Val, the DignaCap is what we have at the R.J. Zuckerberg Cancer Center. It's a machine that hooks up to a cap. There are some places that don't have these machines, and that doesn't mean that you cannot do cold capping. That means that you may have to contact a program and bring in your own caps. And basically the whole mechanism behind the cold capping is that a very cold cap is placed directly onto your scalp, very skin tight, while you're getting the chemotherapy. And what happens is that the blood vessels in the scalp, they constrict, so the chemotherapy cannot get to the scalp and to the hair follicles, and therefore should help to prevent hair loss or minimize hair loss. This being said, there's a lot of technicalities to it. You know, the first thing is that it's very patient driven. So what happens is if a patient decides that they would like to do this, they will have to contact the company, whether it's the company with the machine or with the caps that they'll bring in themselves in a cooler, or sometimes an institution may have a cooler for you to store them, and figure out the sizing and things like that ahead of time. You know, there are a lot of technical things on the day of the treatment where you have to wear the cap before the treatment begins. So your scalp gets nice and cool before the chemotherapy is actually infusing, and also wear the cap afterwards. So if you are using a machine in the facility that you're in, then you'll be there a little bit longer. Sometimes it could be 20 minutes or an hour, depending on which system's being used. So it does lengthen your treatment time, depending on how long the treatment is. Sometimes if patients are bringing in caps, they have to change them throughout the process of the chemotherapy. So they actually will need someone to help them with that. Sometimes that's a family member or a friend. Sometimes there's a staff member that can actually do that for them. And sometimes people actually hire people to come in and do that. So that's all goes into kind of the planning aspect of this. The other part of the planning is also the figuring out the cost. It can be a very costly procedure, but we are seeing that more insurances are starting to at least partially cover it in some cases. So it's really good to talk to your insurance company, because you just don't know until you ask. When you're there on the day of the treatment, it can be uncomfortable because it is very cold. So your provider may have to give you some extra medication, possibly to make you feel a little bit more comfortable during the procedure itself. If for some reason you're not tolerating it and you would like to discontinue it, it's fine to stop at any time. It's always something that you can choose to stop, and you know, and that is absolutely fine. You know, if you go on to lose your hair, you know, there are many ways we can help you with that. If the cold cap is discontinued, and Yoda will go into that more of that in a little bit. So the main thing is to definitely speak to your team before starting treatment. It is something that needs a lot of preparation. So it's something that has to be decided upon before starting the treatment, at least, you know, a few days to a week or so ahead of time, to get that all in place, because you don't want to show up on the day of the treatment expecting to have this procedure and not be able to. So definitely reach out to your team and let them know that you're interested, and they can guide you from there.
So realistically, have you seen people follow through with it and use it through to the end of treatment, or do some people, a lot of people, majority of people, kind of end halfway through?
I would say it's probably about 50%. The other thing, and thank you for asking that, Val, is that it is, like I said before, it's very technical. So sometimes if a patient has very thick hair or very curly hair, and the cap can't fit as snug and as uniform and symmetrical as it needs to, then sometimes patients start to lose hair in different areas, and they may not like the way it looks, so they may decide to discontinue it. And also, while you're using the system, you have to be very, very gentle with your hair. You know, you have to wash your hair with like baby shampoos and very infrequently. No blow drying, no coloring, no ironing. You can't pull it back in a ponytail or use clips. So it's a lot of work. So I would say probably about 50% of the people that we see start to use it continue on and have success. And then probably about the other half, you know, may not like their progress with it.
But if they stick to it, it does help.
It can, yes, it can. There is still a chance that you may lose your hair. So, and, you know, at each visit with your physician, you know, you can go over how you're doing with it, to, you know, to decide, am I going to go forward for the next time? So you don't have to say in the beginning, okay, I'm going to do every single treatment with it. We can reevaluate at each visit and see how you're doing.
So the moral of the story is you always have the choice.
Absolutely.
Always have the choice. The control is in your hands. Okay, so you decide not to cold cap because you're like me and you can't stand being cold. Although my hair is important to me, I don't think I could tolerate being that cold. So I lose my hair. Yada, tell me, what are some of the things that we can do? I know hair is so much a part of people's identity. I know it certainly is for me. And Jenny, I'm sure you've seen it with all of the patients that you go through and see and what they go through. So what are some options for people who lose their hair?
Absolutely. Thank you. So hair loss is almost always temporary. When it, you know, can start growing back 3 to 6 months after treatment time. We offer various solutions, and I'm going to be showing you. I'm actually wearing quite a few of them right now. You can consider changing your hair length before it, if it may not fall out, but if it does, you may want to go a little bit shorter slowly. So give yourself a little haircut before treatment. Another thing you may want to do is at nighttime, you know, wear a turban or a lightweight mesh cap to catch anything that may be shedding. Supporting the hair, you know, the health of your hair follicles, obviously. Hydrating and massaging works really, really well. You can also, we were talking about skincare. Skincare doesn't stop at the hairline, you know, definitely consider your scalp as well. Pamper your scalp. Use a soft brush to massage. Exfoliate with a terry cloth towel or even a paper towel. Using moisturizing conditioners, gentle shampoos. You don't want to overcomb or brush your scalp. You know, obviously, just like Jennifer said, no hair coloring or relaxing at this time unless your physician okays it. You want to avoid, you know, heat styling tools, and obviously no glues or tapes on the scalp, which is something that comes up when we talk about wigs and hair pieces. So you can consider trying wigs and alternatives. And again, another workshop we offer is, you know, the head covering portion of our Look and Feel Better workshop. And what I'm demonstrating today is layers of that. And I have different things here that I could show you quickly. So this is just a quick head covering. It's just a scarf that, oh, and a bang piece that I just incorporated in there. So that little bang piece that you saw there is just a little piece of bang that I put under my scarf, and it looked like, you know, I have a full head of hair there. Now, the scarf that I'm wearing is just a plain scarf that I treat like long hair. So what I have here is a hair tie, just a generic hair tie. My scarf lays right over the top. I go ahead and treat it like a ponytail. Okay, so I take my hair tie. I don't even worry about tying knots or anything. I just take my hair tie and tie it like so. And then you can take these two pieces if it's really cold and use it as a matching, you know, neck covering, or just go ahead and wrap it right around the top again in double knots. And you can create that flower kind of like what I had going on previously. Another thing you can do is,
love that look.
oh yes, so this is a wig. It's a full wig, all right, head covering that will cover your hair. Many women will say, well, the wigs are too hot for me, or they make my scalp itchy. There are so many other things that you can do. If you don't want the full wig, you can wear something like, you know, just one of these where it just goes over the top of your head. It's completely hollow there, and then, you know, wear your hat right on top. All right, and you have like a really cute, I'm going to go visit the kids' games. There are toppers that you can put if you haven't completely lost your hair. And then, of course, you know, these completely transform your look. You can try different colors at this time, but what I was hoping to demonstrate was that with just a few little tips and techniques, you can bring that hair back. You can bring your look back. Don't get discouraged if you are experiencing hair loss or thinning, because like you saw here, there are so many different things that you can do to go ahead and kind of disguise that. There's wefts that you can pop into the inside of your caps. You know, you just sew them right into the inside or slip them right into the inside of your cap, and it gives the illusion that you're wearing, that you have a full head of hair. And again, the mesh allows you to breathe, and you can wear something as soft as like a cotton wig cap with that. There are ponytail pieces that you can attach to the ends of your hats. And again, the only reason I'm talking about these partial pieces is because we do get complaints that sometimes it's itchy or, you know, it's just too hot, because this is our cooling. This is our auto cooler right here. And so when we cover our scalp and our head, sometimes it's too much. And then you've got like these half halos is what we call them, that you can go ahead and pop on. These are really easy too. One second, sure, you can see me. Okay, can everybody see me okay?
Yep, we see you, but
yep. So I just popped on one of these guys, and again, your hat can go right over the top, and you're changing your look again. So hopefully those were some helpful little tips here. And in terms of caring for those wigs and hair pieces, we always recommend following the manufacturer's directions that almost always come with them in their little pamphlet, just like this. Follow the instructions that are there, or the easiest thing you can do is just get a baby shampoo, fill up your basin with, you know, some lukewarm water, and then swish your wig around in there, and then make sure that you're not combing or over brushing when your wig is wet, and then just go ahead and let it air dry.
so you can wash a wig just like real hair or a hat or anything else.
Yes.
Okay.
Double check your instructions though. Just nowadays, everything is so different. And I think we were talking about this before. Everything is so different. And they're so innovative with the different fibers that are used. Everything comes pretty much with a little pamphlet on a care pamphlet on how to better care for your wig products, because they're definitely not, they're not cheap. So follow those instructions. But if all else fails and you don't know what to do and you really need to clean it, I would just say swish it around in a basin of lukewarm water with maybe some baby shampoo, and then wait till let it air dry. You can use, you know, a wig stand or even a paper towel roll holder, paper towel holder, and just let it sit right over the top until it's completely dry, and then go ahead and push it back into shape. These wigs have memories.
And natural versus synthetic hair, is there a difference?
Yes, absolutely. Natural. Many times you can use heat styling tools to restyle it if it is natural. If it is synthetic, some synthetics do not allow any heat because they're already kind of steamed into place. So again, follow manufacturer's instructions, go on the website and look it up. And if all else fails, you know, try a little test strand somewhere where it's not noticeable, you know, on the underside, and see what happens. Also low heat settings always. Like I wouldn't go anything over 275, 250. In a test strand or lower.
So I have a long wig, gorgeous and wonderful. I'm tired of it. I don't want to be long anymore. Can I cut it? Can I style it?
It's a great question. And again, it depends on the wig. If it is, and I hate to say this, but sometimes the inexpensive ones that are stiffer are really hard to style because they're made with just so many fibers or just so many hairs to stay in place. So if you go in and you start nipping away, it may create a gap. Definitely look at what more natural fibers or natural hair wigs, natural hair wigs are the ones that you can restyle. And most of the time they're actually made with more hair, just for that reason, to thin out certain areas so that it lays nicely on the face. And, you know, double check your cancer resource centers to which salons or which stylists do offer that service. And the other thing is to, go slow. Don't be too aggressive because those don't grow back.
Now I'm just checking. That one's real on you. That one's not coming off. You're not gonna.
This is not coming off. But
Just
see,
checking.
did I do a good disguise? Were you able to see how you could change your look?
I can't believe you had all that hair under there, under
All
that
of it.
one wig. That's fantastic. And
Yes.
you were gorgeous each way. So that's a true reflection of beauty. with a headscarf, with a wig, with a hat, you know, it's all fantastic. Okay, so if you're like me, you know, you like a little color in your hair, a little pizzazz maybe. So once you're done with treatment and your hair is growing back, and maybe it's short like mine, can you color it?
So I'm going to say we have to, you know, refer you to your physician to make sure he or she is okay with that. But one thing I will say is when it does grow back those first couple months, you may notice a completely different color and a completely different texture. You know, so that's where you, Jen.
Yes, absolutely. Exactly that. And sometimes that hair doesn't hold on to color that well, especially more like natural products like henna and things like that. So it's usually we say that it's okay to go ahead and dye your hair once it's grown out about an inch or so, but to kind of wait for those first few months to pass. You know, we do recommend maybe trying a more natural product at first. But you can absolutely go to the salon as well. You may just find that you'll have to see if you're okay with handling the smells and everything like that as well too with that process in the salon. So it's a little trial and error, you know, so you may want to, you know, try something first at that, you know, when it gets to about that 1 inch length. And you know, you may or may not like that, and then you may have to try something as it gets a little bit longer and the texture starts to become more of your original texture.
Okay, all right. Well, I would have to wait, but I would be interested to see what it grows back like. So I see that there are a lot of questions in the chat, and I think that we've covered most of what we were hoping to cover. So I want to say thank you very much to Jenny and to Yoda for in helping me answer the questions that I had. But now I think we need to hear from our folks who are here and answer some of their questions. So Stephanie, can I give it back to you?
Thank you, Val, so much. And I would like to thank Yota and Jenny as well for being so helpful and insightful to our guests. And Val, you gave us the amount of humor that we needed in order to discuss such a delicate topic. So thank you so much for that. I am going to actually begin with one of the questions that actually has to do with somebody who did not lose their hair completely during chemotherapy, but it did thin out a lot. So Yota, are there any tips or types of products that might help with regrowth or supporting it getting thicker once it stops shedding?
Okay, so specific to products, again, Look and Feel Better would say refer to your physician. I know that stimulus and massage, anything that circulates, you know, that gets that blood flowing is extremely helpful to those endings, those nerve endings and the follicles. And that's what I would recommend. Now for hair, that's fine. You can use volumizing products, styling products, but you also have to be careful with the alcohol content in some of those products because they can be more drying to the skin and cause a little bit of extra itchiness. So you really have to think, how short is your hair? If you want that extra volume, and let's say you want to use a volumizing mousse, great. But then if you're applying too much and it's sticking to the scalp, it may create a layer or a film that may then turn into an irritation. So consult your stylist, consult your physician, of course. Mousses is what I would recommend.
Okay, thank you so much.
Of course.
Jenny, can you discuss if cold capping can be repeated in somebody's journey if they have been struck with a recurrence?
Sure, absolutely. I think that it's absolutely something that can be discussed, and it is something that could be used if a patient is willing to, you know, go through the process of setting that up with their center. But absolutely, you know, again, it really depends. Sometimes if the hair is a little bit different, if the texture's changed, or it's maybe more thin, or there's areas of thinning, it may not respond as well. But certainly it's something that you can absolutely try again. So definitely.
Jenny, I'm also going to ask you a question that comes to me quite often for people that have tried cold capping. Is it something that if somebody does not have it at their facility, but has to get the products on their own, once they're completed with it, is it something that they can donate to another patient?
That's a really great question. And actually, that's something I didn't bring up before, is that we've actually had, so before we had actually the machines at our center, patients would have to bring their own caps in. And we would even have patients that would share, coolers and caps and things like that and devices. So absolutely, that would be a wonderful thing to do. You'd have to speak to the company that you're using. There's a bunch of different cold capping companies out there. And you can absolutely share with other patients.
Thank you so much, and share the love, ladies. It might be a great way if that's something that you are interested in doing, because it could be costly. Yota, there is a question about having your eyebrows microbladed. If somebody is recently completed chemotherapy, is that something that is a safe thing to consider?
So it's not recommended during treatment time, but again, if your physician gives you the all clear, I mean, you got to think about it too. It is a needle, or it's some type of a blade that's penetrating into the skin. And that could cause, open entryways for additional germs. So double check with your physician.
Okay, thank you so very much.
Absolutely.
Also, Yotze, if somebody's not comfortable getting their hair colored, because they're just don't want to opt doing it, there's so many products now that you could spray to cover your grays. We all learned the tips of the trade during COVID. Is there anything else that somebody could do if their grays are really bothering them, if they don't want to go the route of getting traditional hair coloring?
That's a great question. And I would consider your scalp sensitivity and highly recommend, a hat, a cute, soft cotton beanie. I would just stay away from anything chemical at this time, unless, of course, your physician okays it. But
Okay,
I wouldn't go get a specific product, because that's another thing too. When you're adding these things that are pigments, it may be harder for you to remove. And so if you're going in and trying to remove it, it may cause an irritation just because you're being a little extra abrasive to that sensitive skin.
Okay.
Stephanie, I'd like to just add that, hats are probably your friend at this point, right? Because they protect your scalp from the sun, even now when it might not be hot out, you still get sun exposure. So a hat may be a good thing, or a scarf, or something, but to cover that head and make sure that skin stays out of the sun.
With that said, can you actually repeat again what you believe is the recommended SPF number that those going through active treatment should make sure that they're wearing on their face, and if they are actually active out in the sun, covering their body?
Yep, that's an SPF 30 or better, right? 30, better doesn't really matter so much. And then reapply, frequently. And don't be afraid, a good dollop.
Okay, great, important piece of information. So Yota, I know that there's not the specific products that look good, feel better, endorse as a brand name, but could you at least share, if somebody is looking for clean makeup lines, is there specific products maybe that, not products, is there specific ingredients maybe that they should be looking on as they're looking at labels?
Specific ingredients to look for?
Mm-hmm. Or to make sure the product does not have, if they're looking for what's quote unquote called a clean makeup line.
No, I don't. We can't quote that. Thank you.
Okay, no, I appreciate that. No, I just wanted to say, and
yes, there are in the chat, some people have recommended
Thrive.
some products that they have used. Yeah.
Some Thrive Cosmetics. I think we all, it's a big thing for us. Thrive Cosmetics, great. A lot of women say it's great mascara. So I think that is extremely helpful.
That's because their packaging is teal.
Yes. We do like that. 100% it's on brand. Can you also recommend other natural options aside from henna? Could anybody speak to that?
I've never done it, but I've heard, beet juice makes a nice red.
Please don't do Kool-Aid. It's very, that's a
yeah.
joke.
Right. It'll never come out.
It'll never come out.
Jenny, I think this is a great question for you. Does sun sensitivity ever return to normal after treatment ends?
That's a great question. I believe that it does, as the body gets away from the chemotherapy and our skin cells start to regenerate and become back to their pre-chemo strength and sensitivity, over time that absolutely will go back to normal. We do still recommend to protect yourself from the sun, really at any point, we want to protect ourselves from the sun. Even, we know that when patients are on treatment, their skin is much more sensitive and they can burn more easily. But, regardless, we want to limit sun exposure, stay in the shade, use hats, and try not to be in the direct sunlight for more than maybe, 5 or 10 minutes, even when we're off treatment, because we want to protect our skin from, from other things that can happen. So I do think that it will become less sensitive over time, but we still need to protect it.
Unfortunately, those of us of a certain age who are copper tone babies, right? And we would go out and we'd want to get that sunburn. We'd want to get those tan lines. We'd want to show that we were healthy. There's nothing good about the sun. The sun doesn't do nothing good for your skin. It breaks down the DNA so that that's how cancer starts, either basal cells or melanomas. And it puts lines in it and it gets you old looking. And, really we should treat ourselves better by staying out of the sun, but socially that's not what we do.
Remember that SPF 30,
30.
before you walk out the door. Very important. So Yoda, would you do us a favor? Could you demo one more time how to do the wrap on your head with the scarf, with the ponytail?
Absolutely. So I'm just going to pull my hair back. I'm just moving my hair out of the way. If you've experienced hair loss, if it's thin, this still works. If you have a full head of hair and just are sensitive, because your scalp can be sensitive, this works as well. You just go ahead and move it away. So I've taken
great beach look for those of us that have colored hair that don't want it exposed to the sun.
Exactly.
But I just said we're not supposed to be at the beach.
Or bonfire hair if it's nighttime, right? Because it'll smell.
There
This
you
actually
go.
works. This works. So I've gone ahead and I draped.
Great idea.
Yes, ma'am, it works. So I've draped the scarf right over my head, and then I will tie it just like I would a ponytail. So treat the scarf like a ponytail with a hair tie. Really simple hair tie. You can make it as tight or as loose as you'd like. And depending, you can use those really long scarves for this and use this hair elastic as kind of like your holder where you could tuck pieces in. You can also do it on the top if you wanted to, and create a large bow if that was your style, and tuck it into those the elastic arms of that hair elastic. So now I've taken these pieces here, I'm gonna put my eyes back in. There we go. These pieces here, and I'm just kind of pulling so it's nice and snug, how it's comfortable for me. And then you can also twirl. You want to get creative. Again, you can use it, you can kind of make a turtleneck out of this and twirl again. And then I'm just going to go ahead and tie a knot right up here. And at this point, I've seen ladies get so creative with flowers that they've added, brooches. You could take another scarf and kind of decorate this as well. And there you go. Really simple.
Simply amazing, Yoda. I think we always should have you in our rooms at 8 o'clock in the morning when we're trying to get done for the day. That is amazing. I hope everybody's kind of took some notes about that tip. That was fantastic and beautiful. Looks absolutely stunning. So thank you for that.
Thank you.
And silky scarves at night? If you're sleeping and you don't want to, rub your head on the pillow or wrap it up, just a regular scarf at night, right?
Mm-hmm, absolutely. I'm going to reverse this real quick just so that you could see for nighttime. You can pretty much do this because I don't know about you. I don't want the knot back there or the hair tie back there. And just how you would wrap your hair in a towel turban out of the shower. just cover up. I think I've twisted a little bit. That's okay. And bring this forward like so. Get that hair tie, trusty hair tie. I have a long one. It doesn't really matter. And then go ahead and bring the ponytail up at the top. And this is what I was talking about. If you've covered this whole area in the back, then it's just more comfortable to sleep in. And then you can leave this, you know, tied up in a knot or decorated however you'd like, or just like this, you know, just leave it so you don't have that added pressure on your scalp. But to go out for the day, you can go ahead and do that exact same thing, twisting and tying and creating that bow look, or taking like those little elastic arms, like I said, and just tucking. You really don't have to do much, just tucking and hiding that piece right here in the front if you don't want that pressure on the back. And sometimes even when you're driving, having that knot back there could be annoying depending on how big your scarf is and how much extra material there is. I hope that was helpful. But yeah.
In the convertible, right? When you're driving
In the convertible.
in your 1940s. Yeah.
Or the Bronco as you're going uphill.
That's right.
Yota, is there
Yeah.
a specific how high or low it should be on somebody's forehead, or is it more a matter of comfort?
Comfort, definitely. If you're experiencing hair loss, some ladies like it to cover the hairline, so you can bring it a little bit lower. I always say about 3 fingers is comfortable. It's appealing to the eye, 3 fingers right above the brow bone, but that's not necessary. It's just look in the mirror. You love it, wear it. You don't, adjust it.
Excellent. I love it. Thank you so much. You're so creative.
Sure.
I appreciate that.
Absolutely.
Jenny, this question I think is for you. Where can we expect hair growth after treatment? Any changes in our body is the question. So I'm thinking what they mean is after treatment, and women have shared that they lose their hair everywhere. Where can they expect the regrowth?
Sure, that's a great question. Technically, it should come back everywhere, and sometimes even patients tell us they get it in places where they don't necessarily want it, and it's a little bit more like facial hair and things like that, which can be bothersome. And some patients don't get it back in places where they don't want it, you know, like their legs and things like that. So that can be a beneficial thing. So the hair can grow back at different times after the treatment. Usually about a month after the last chemotherapy is when you'll start to see kind of that peach fuzz come in different areas of the body, and then you'll kind of know where it's coming in. I think you have to give your body probably a good 3 to 6 months to see exactly where it's going to be, to know exactly where that hair is going to come in. But you know, again, it can sometimes come back. I would say that more often we see it come back in more areas than it was pre-treatment rather than less, you know, with that possibly more, you know, facial area hair that can be bothersome sometimes, you know, so that is something that we hear about from some of our patients.
That's very true, because actually one of the questions that we received, and you know, perhaps you could answer and provide some guidance on this, had to do with facial hair. Some patients have shared that they have, unfortunately, a lot of facial hair, very dark, very coarse, that has come back after treatment. Is it something that, can they shave? Can they get it waxed? Like, what is an appropriate routine for somebody in that situation?
Okay, so Look and Feel Better would recommend that they do partner with their physician and maybe refer to a dermatologist. From a cosmetologist point of view, I would just say shaving could cause irritation. So you want to be careful with that. And of course, shaving and plucking, any type of removal, will most of the time cause the hair to come back a little bit more abrasive or a little bit more aggro than normal. So I would say take a look at how much we're talking about. If it's like 1 or 2 hairs, you may just want to consider tweezing it. If it's more than that, then definitely partner with your physician and double check on what removal system would be best for your skin type and for your sensitivity level.
Thank you. That was a very thoughtful answer, because it is always about making sure the patient goes back to their doctor to make sure they get the appropriate guidance and who to seek. And Yoda, before we end, can you share a little bit more about your specific programs at Look Good, Feel Better? If somebody wanted to participate in the programs that you discussed, can you share a little bit about how they might go about doing that?
Absolutely. You would just go ahead and sign up online at lookgoodfeelbetter.org, or you can ask your physician about it and see if they have some direct access, because sometimes some of our programs are offered inside the Wellness Center. Our virtual programs, again, are online. We offer skincare and makeup. We offer a wig and head covering. And we also offer nail care, body image, wardrobe, and styling workshops that you can also check out online and on YouTube to get a better taste of what we do offering class.
Wonderful. And you could do this from the privacy of your home and get an expert like you coming right in.
Yes, we are all licensed professional volunteers. Yes.
Wonderful. Well, I cannot thank the three of you enough. I thought that you did an excellent job this evening, and you really enlightened people. And I hope our audience tonight walks away with a lot of valuable tips that will help you feel good about yourself, regain your self-confidence, and when you look in that mirror, see your self-worth again. So I want to thank all of you for joining us tonight, and we really appreciate it. And I want you to know that anybody that attended tonight, we are going to follow up with resources. So this way you can find Look Good, Feel Better. There are some local resources here. For example, in Long Island, New York, there's an organization called Mondays at Racine's. There is other organizations, Charette, that will help with wigs. So there's a lot of valuable resources that we are going to compile and put together for you and make sure that we send that as a downloadable for you to have. But I want to thank you, Valerie, also for giving us a lot of humor tonight and guiding and directing this conversation. And Jenny and Yota, I want to thank you both for sharing your expertise and knowledge with everybody tonight. It was a gift. So thank you so very, very much.